Hello! We here at Clarity are ready to help alleviate some of the stress and concerns regarding the upcoming changes to the PMHNP exam format starting April 28th of this year. First, you will not be able to take the certification exam the week prior to the new exam start date. It will be important to plan accordingly. There will be a 5 business day exam suspension from April 21st through the 27th to allow for the exam to be updated. All exams administered after April 27th will be based on the new exam format. Live remote proctoring for at-home certification testing is no longer available as of February 1st, 2023. Don't panic. Those already scheduled to take it at home may still do so. However, if your examination has not been scheduled, you will no longer be able to test from home and must go to the Prometric site to test. Now, what hasn't changed? The exam still allows 3.5 hours to answer 175 questions, of which 150 are scored, and 25 are considered pre-test questions that are not included on your final total. There have been no changes made to how the exam is scored. You still need 350 out of 500 total points or 105 out of 150 correct answers to pass. Additionally, there have been no changes made within the body systems, drug agents, and age group categories on the examination. These remain the same. So, what will be different? Changes have been made to the 5 content domains. Some content has been removed, while new topics have been added. Question allocation from each domain has also changed. Let's take a moment to look at each one of these separately. Domain 1, Scientific Foundation. Currently, there are 30 scored questions, or 20% of the total exam questions, falling under this specific category on the certification exam. Starting April 28th of 2023, this will increase to a total of 33 scored questions, or 22% of the total amount of questions on the exam. No other topics have been changed within this category. You can continue to practice and study as you currently are. Domain 2, Advanced Practice Skills. Currently, there are 38 scored questions, or 25% of the total exam falling under this category. Starting April 28th of 2023, this will increase to 41 scored questions, or 27%. Motivational interviewing has been removed from Domain 5 and relocated to Domain 2. The Alcohol Use Disorders Identification Test, or audit, and the Drug Abuse Screening Test, or DAST, have been added to this section. Domain 3, Diagnosis and Treatment. There are 37 scored questions, or 25% currently. Starting April 28th, this will increase to 33 scored, or 22%. No other topics have changed within this specific category. Domain 4, Psychotherapy and Related Theories. Currently, there are 22 scored questions, or 15% of the total exam falling under this specific category. Starting on April 28th, this will increase to 17 scored questions, or 11% falling within Domain 4. The topics of grief and loss have been removed from this domain, and we can now include humanistic, interpersonal, and behavioral therapies to Domain 4, Psychotherapy and Related Theories. Domain 5, Ethics, Legal Principles, and Cultural Care. Currently, there are 23 scored questions, or 15% of the total exam falling under this category. Starting the 28th, this will increase to 26 scored questions, or 17%. Cultural and spiritual competence will move from knowledge to skill within the domain. This includes belief systems, existentialism, social detriments of mental health, risk factors and barriers. Equity, diversity, and inclusion to include specific populations, sexual orientation, and gender identity will be added to this domain. Okay, those are the major changes. Luckily, Clarity Education Systems was already teaching the majority of this new material. Over the next few weeks, we will continue to update the seminars and include any new topics while removing any outdated information. By mid-March, the seminars will include all of the information needed to prepare for the newest exam format. Ultimately, you don't need to do anything different. we've got you covered. We look forward to having you join us as we help you prepare to successfully complete the PMHNP certification exam. We will see you in the seminars.